Good day, everyone. My name is Nurse Esther Solomon-Okorozo, and I'm a registered nurse, a content creator, public speaker, professional volunteer. Greatest last words. It's a privilege and honor for DLCF last word to invite me to speak concerning vaginal infections and ulcer. Do well to ask your questions. There will be a Zoom presentation so that you can lay down all the questions you have in your mind after this presentation. There will be pictorial view to this presentation. Thank you so much to all the leaders and the fellowship. God bless you. So today we'll be discussing about vaginal infections first before we move over to what is ulcer. So I know you know your vagina, right? All the ladies in the house say hi. Okay, perfect. So as a lady, you should know your vagina. You know that part of those places where you pee, part of those places where you menstruate, where blood comes out. Those parts of your body are your vagina. So here is a pictorial view of how your vagina looks like. So let's continue. I hope you jot down something and listen. Vaginal infection is when there is an invasion of a microorganism, and when this microorganism invades into your vagina, that means the place around it or the vagina itself, it brings pain, itching, and rashes. Pain, itching, and rashes, those are the peculiar symptoms. So what else do you see? Some of the symptoms that, have you gone to eat yourself before and then you notice that you're going frequently and you notice that there are small drops of urine, but it's paining you and you're asking yourself, why am I so hot? What is paining me in there? You see that sometimes there can be swelling of your vagina. Those are the symptoms, what you experience. Also, you also notice that you will notice that there is itching. You'll be scratching all the time, and you'll be telling yourself, I wash my pants now. I wash my pants, but why am I scratching? You also be feeling pains around that axis. It shows that there are symptoms of vaginal infection. Now, how do this vaginal infection come? Sometimes it comes during heat periods. Some ladies sweat in between their lap and they don't lubricate before wearing. Some people wear tight for 24 hours. They will not pull it. They will not wash themselves. They will not use tissue to clean their urethra whenever they urinate. They will not clean it. They will just go and eat themselves. The small drops will be dropping on their pants, and you will find out that this particular set of ladies will start to scratch as the time go. Some people too don't even change their pants. When they wear it today, they will bring it, they will say, it's not smelly, no. They'll say, let me wear it tomorrow. Those are the things that attract vaginal infection. And some of them, they don't wash their pants on time. They don't sun dry their undies. Even if you have to put your undies, that's your underwears, on the sun, you can use a cloth to cover it. As far there is an invasion of the sun rays directly to your pants to kill the microorganisms that are there, it's a perfect win-win for you. It is a win-win for you. Now, it is also noted that some ladies don't wash their underwears and they keep on repeating them for a long time. This can bring discomfort later. It can make those microorganisms that are in your vaginal axis. You know that God has actually created some microorganisms that prevents germs, different things from your environment to enter into your vagina. That is why there is always mucus presentation. Mucus, that's those whitish discharge. But once your own is now milky, smelling, instead of just the white normal thing, you know that there is problem. Those are the symptoms that you see as invasion of these microorganisms into your body. Normally you have a white mucus, but once you now see another color such as brown, such as gray, such as white with other things, you know that this particular lady is having a problem. So why is yeast infection more common in female? Because we have a short urethra. Unlike men is about 15 cm and more. That means, like, let's look at the size of their penis. But for ladies, ours is just 10 cm and it's very short from the bladder to where our urethra is. So microorganism can just fly into that place. Now let's look at ways that we can prevent it. Number one, wear breathable pants. It's not a sin to wear pants, but it should be worn at the right attire. It's not a sin to wear tights, but it should be worn on the right attire. Wear breathable pants. Some days, if it's not pants, wear tight. If it's not tight, wear pants so that you can be able to breathe. Another thing is that ladies should learn to stop using feminine products. All these vaginal wash, they are cancerous for you over time. Stop using them. You don't use any products, any vaginal wash. Water is enough for you. And as a lady, don't overuse water to wash all the time. When you use yourself, because when those water droplets drops on your lap, you might not be able to clean them all the time. That's why it's advisable to use wipes or tissue paper. Once you urinate, ensure that you clean up immediately so that those droplets doesn't cause that place to be swampy. And you see how when a place is swampy, microorganisms tend to grow there, such as mosquito, algae, and you see green stuff on the wall. It's applicable to your human body. The next thing is that you should learn to change your pants at least every 6 months. Every 6 months, change your pants. Stop using the one that your mommy bought for you during Christmas in 2020 and you are still using it to now. No, it is wrong. Avoid hot tubes. Some people say when you start to scratch or when you start to notice anything, go and sit down in hot water. My love, it is not good for you. It is not good for you. Then always ensure that you sun dry your underwear. You can sun dry them and use a particular wrapper to cover them. They will still dry well. Then good hygiene, where you sleep, where you stay. Then factors that can increase this vaginal infection. Let us learn together. I hope you're learning and I hope you have questions to ask. Factors that usually increase vaginal infection. Number one, antibiotics. Every small thing you will think is a typhoid, you go and rush, I'm not feeling fine, you will take an antibiotics. They can predispose that vaginal area because God has naturally created microorganisms there that helps to fight against any disease. But once you take antibiotics, they stop the growth of those microorganisms that lines that vagina, and that is why taking of too much antibiotics without the prescription of your doctor, it's actually wrong. Then if you have a weakened immune system, that means your immune system is compromised either by a disease or by any of your cells, there's every possibility that you have a vaginal infection. Then being pregnant, yes, most times pregnant women are predisposed to vaginal infections. You know why? Because of the constant urination, constant production of mucus in that particular axis when you are pregnant. So being pregnant now will make you to urinate at multiple times. Thereby you see that your pants is being dabbed. Then you find out that particular area sometimes there are droplets if not properly cleaned. That is why vaginal infection can come. So out of all of this that we've learned today, there is also a treatment for it, and it must be prescribed by your doctor or by a nurse. But I've told you that good hygiene helps to prevent vaginal infection. I hope you have your question. So now let's listen to the next slide that talks about ulcer.